Hi everyone, my name is Angelica and I am the teaching assistant for your Psychology of Sexuality class. And I am going to be providing a video just going over the module that discusses sexually transmitted infections. So I have a presentation that I'll share with you guys and just talk a little bit about it so you guys can get a little bit more familiar with the STIs that I have in this presentation, which is not extensive by any means. These are just some pretty common ones that I chose to kind of go a little deeper. The first thing that we're going to go over is kind of the difference between STI and STD. So sexually transmitted infections and sexually transmitted diseases. And for the purposes of this presentation, as well as your textbook, we kind of refer to them as STIs because it encompasses both STDs and STIs, which is just the infection when pathogens enter the body, and that can be bacteria, viruses, or parasites. And when this happens, these infections can be present without actually having any symptoms show up for the person. And that's kind of the difference with sexually transmitted diseases. So they are going to have symptoms that are produced from the infection, and the infection will disrupt normally bodily function or structures. So it's kind of the more progressed or physically present STI version. And so, yeah, we will be referring to everything as a sexually transmitted infection. And to get us started, we're going to go into bacterial infections. The first one that we will talk about is going to be chlamydia. All of these slides are going to be set up in a pretty similar manner, talking about statistics, US statistics specifically, symptoms and treatment. And this information is going to be from a combination of the textbook as well as the CDC's website. So if there's anything you guys want to check out, the textbooks mentions it as well, but the CDC has an extensive just list of STIs, treatments, just a lot of really great information about this topic. But so yeah, there was 1.8 million cases in 2019. And this was in part of the 6-year rise that has been happening with this STI. And so it's also going to show up more in women. The website from CDC talks about how this has partially to do with women getting tested more, but it also has to do with women being more susceptible to contracting STIs, specifically people with vaginas contracting STIs. And then 61% of these cases in 2019 were among those that are 15 to 24 years old. This is pretty consistent with the book, and it's pretty similar to gonorrhea. It's pretty common among young people. So important to understand this information, and just thinking back on some of the previous modules, thinking about sexual education, how this can kind of affect that. So for symptoms, they are going to be a little bit similar between people with penises and people with vaginas. To start out with those with vaginas, they could experience an abnormal vaginal discharge or a burning sensation when urinating. That burning sensation will be common among people with penises, and they can also experience discharge from their penis. Less common symptom for those with penises would be pain or swelling in one or both of the testicles. And then another symptom that can occur from long-term chlamydia that goes untreated is the potential for infertility or sterility in people with vaginas or people with penises. And then the treatment for chlamydia is going to be antibiotics, and this is going to be common across all of our bacterial infections, but there are 1-day or 7-day antibiotics, and these to truly treat the infection, and by truly treat, I mean not be at risk for contracting it after you've completed treatment, is to make sure that all of the sexual partners who you may have been in contact with are treated as well and complete their treatment, you and your partners, before you engage in sexual activity again. And then we will go next is gonorrhea, also known as a CLAP. For a long time, I thought the clap was chlamydia, but it is in fact the slang name for gonorrhea. So some statistics on this STI. In 2019, there were 600,000 new cases. So this was a 92% increase since 2009. So it is on the rise, and there are higher reports among men. And it has been increasing across all demographics. So women are seeing an increase as well, but there's just a more significant increase among men. And gonorrhea has started to develop to become antibiotic resistant, which is a growing concern because that would affect the way that it is treated. And then these symptoms are going to be similar to that of chlamydia. So you'll see the painful or burning sensation urinating for both people with vaginas and people with penises, similar to chlamydia. And then here in people with vaginas, we see increased vaginal discharge, or there's possible vaginal bleeding between periods. Then for those with penises, a white, yellow, or green discharge from the penis. It's going to be an indicator. And then again, less common, but is possible, the painful or swollen testicles. This will be treated with a 1-day or 7-day antibiotic. Since gonorrhea is a bit more resistant, it can be difficult to treat. And so it's recommended to retest after treatment to make sure that the infection has cleared from the antibiotic treatment, especially with the antibiotic resistant gonorrhea being more on the rise. So syphilis. This STI has a particularly dark history in the United States. The Tuskegee experiments that went on in Alabama were experiments where Black men were infected with syphilis and not treated because researchers wanted to better understand syphilis. But we already knew the treatment of antibiotics for this STI. And this is an example of, in our country, in the history, the health inequities that are present. Some recent statistics on syphilis. In 2019, there were 130 cases. 130,000 cases. And this was combined of all the different stages that are listed under symptoms. And males that have sex with males are disproportionately impacted. But there has also been an increase in women. The different stages that syphilis occurs in, the primary stage is firm, round, painless sores at infection site. So this is something that can be easily written off or assumed to be a different skin condition. And then during the secondary stage, that's going to be more ash that will appear on the back of the hand or the back. And then also mucous membrane lesions. So this is going to be in orifices like the genitals or the mouth where you can get open lesions. And then there's also some flu and cold-like symptoms. So fever, sore throat, hair loss, headaches, weight loss, muscle aches, and fatigue. And if it goes untreated, it can progress into the latent stage, which refers to when symptoms might have cleared, but the infection is still present in the body. And then if it is still left untreated, it can progress to the tertiary stage. Most people don't develop to this stage, and it can occur anywhere from 10 to 30 years after the infection. Can be faster and it can take longer. But the disease damages the internal organs and can result in death. As I mentioned before, the treatment is antibiotics. Penicillin specifically is normally the treatment unless someone is allergic to penicillin. So to talk a little bit about viral infections, we will start off with HPV, which is the human papilloma virus. This is an extremely common virus in the United States, and it's so common that CDC says any sexually active person will most likely contract the virus in their lifetime. In 2018, there was 13 million new infections and 43 million infections total. And so symptoms for this, someone could develop genital warts or cervical cancer. It's a type of cancer that can be developed from HPV, but there's other types that can be developed as well. But it can go unnoticed and cannot present a lot of symptoms for a lot of people and a lot of the different types of HPV that exist. One way that people can find out that they have it is if they have an abnormal pap smear, and then that would indicate to the doctor, and they could test for HPV. And so there are HPV tests that can be done for women, but not for men. And it's not necessarily recommended for people to be regularly tested for HPV if they're under 30 years old. There is no cure, again, for all of these viral infections. There won't be a cure, but there are treatments. And specifically in this case, there is the HPV vaccine, which is a 3-shot series, and it's approved for anyone 9 to 45 years old. It protects against 9 different cancer or genital warts causing HPV. But again, there's over 100 kinds, and a lot of them don't cause symptoms. So they do recommend to, even if you have already contracted HPV and tested positive for HPV, they would still recommend you getting the vaccine just to protect you against those more dangerous types. And then the next one that we are going to talk about is going to be herpes. And there are 2 types. So there's HSV1 and HSV2. HSV1 is going to be more commonly associated with mouth herpes or cold sores, and then HSV2 is more commonly associated with genital herpes. But either can be present for genital herpes because they can be spread through bodily fluids such as saliva. So during oral sex, if someone has HSV1, they can give another person HSV1, and that could result in genital warts. Also very common, 1 out of 6 people ages 14 to 49 have genital herpes, and it's more common among women. So some of the symptoms are painful blisters at the site, so either around the mouth or around the genitals, and it can often be mistaken for an ingrown hair, pimple, an unrelated skin condition, and people don't always know that it's herpes. It's also very common to have the infection and have no symptoms at all. But something about this particular STI is that the symptoms don't progress to any other stages. So it can be managed to decrease the severity of outbreaks and the amount of times that someone experiences outbreaks. And so one of the ways that this can be done is through antiviral suppression medication. It lessens the symptoms during an active outbreak and decreases future outbreaks for that person. There's also other ways like keeping the area dry or trying to manage stress levels. So just trying to maintain a healthy lifestyle is an important aspect for someone that is trying to manage their herpes outbreaks. And then the last viral infection that we're going to talk about is the human immunodeficiency virus, HIV. So in 2019, 1.1 million people had HIV, but of that statistic, only 13% of them didn't know that they did have HIV. And then Black and Latino males that have sex with males are disproportionately impacted. The CDC suggests that this can partially be attributed to access to healthcare, a lot to do with socioeconomic status, and those that engage in anal sex. Symptoms, I kind of broke it down again into the different stages. So acute HIV infection, this can be accompanied by possible flu-like symptoms, and it's very contagious due to the high viral load, which is like how they refer to the HIV present. And then the next stage is chronic HIV. So this is if it hasn't been treated and is just continuing to progress in someone's body, referred to as the latent stage as well, which similarly, as we've seen before, latency refers to when the symptoms have kind of gone away, but the infection is still present in your body. So at this time, HIV is producing at low levels, but there's still HIV in your body, and it can last a decade or longer. And when someone kind of comes to the end of the stage, they will experience a really dramatic peak in their viral load. And then if it is left untreated, it can turn into AIDS, which is acquired immunodeficiency syndrome. Which, when it does progress to that, the person would have a very high viral load, and they would also be extremely immunocompromised. And so that's really dangerous because they are weak to other infections that can result in a lot of damage to the body because their immune system is already so compromised. And so once someone does have HIV, there's no cure, again, like I've been saying, for all the different viral infections, but it can be treated and managed in a similar way to live a long, healthy life. And so one way to do that is the antiretroviral therapy. And so with this, it is a medication to help manage the viral load and keep people, they can be close to undetected through this. And then there's also PrEP, which helps to prevent the contraction of HIV, and it's normally recommended for people that are high risk, so specifically the people that we mentioned before that are disproportionately impacted by HIV. So to finish out, we're just going to talk a little bit about protection and ways to prevent STDs to keep you and your partner safe. So just understanding the concept of safer sex and knowing that if you are engaging in sexual activities, whether you're using condoms or, there's some myths around that STIs can't be contracted from oral sex or anal sex, but any sort of contact with bodily fluid and with genitalia presents the risk of contracting an STI, and abstinence is the only 100% risk-free option. And another way to kind of ensure that you are keeping you and your partners safe is regular STI screenings. So it's really important when you're having sex with multiple partners or in a committed relationship. Again, just that risk-free option isn't there when you're having sexual activities. And just to protect yourself, it's recommended that you still do STI screenings, especially if you're noticing any changes in discharge, bleeding, pain, anything like that. And then just some methods to kind of protect would be condoms, dental dams, and lube. So the middle picture with the yellow background, that's going to be a dental dam. And then we have some condoms and lube. The lube can assist in preventing the spread of STIs because it can prevent friction. And when you get that friction and tears in the skin and you have that opening, there is a higher chance of contracting STIs. And then I just have one final slide with just some kind of useful information. There's a little infographic on how to use a dental dam, as well as how to apply a condom, because that's another way that people often can contract STIs when they think they're being safe, is if condoms are put on incorrectly. And then I really liked this graphic that just kind of went over when to expect results for these different tests and how long they can take. And I wanted to mention that like HPV isn't on this on this list. And there are other ones like hepatitis. So there are a whole long list of STIs. And today I just went over a couple just to provide you guys a little more insight on those ones. But definitely lots of information that is out there beyond what was in this presentation. So yeah, I hope that you guys learned something and that this was informative. Feel free to reach out through email with any questions, and good luck on the rest of your semester.